Hi, this is Dr. Subhakar, Clinical and Interventional Pulmonologist, Department of Pulmonary Medicine, KIMS Kondapur. Today, we'll come with an interesting case. This is a 67 years old male with bilateral cystic lung disease. He had a large thick wall cyst in the right lower lobe with air fluid level. He came with dyspnea and type 1 respiratory failure. He is a known COPD patient and a chronic smoker. He was on ICS, LAVA and LAMA from the past 3 years. This time, when his CT was done, we saw treatment bud appearance and on bronchoscopy, AFB and gene expert was positive. He was started on ATT and sent home. After 2 months, he came with pneumothorax, that is, one of the cysts ruptured. So ICD tube was placed, and after 12 days of follow-up, we have suggested him to take an opinion from thoracic surgeons. Thoracic surgeons saw the case, evaluated, and they took up this case challengingly. They have given him option of the right lower lobe cystectomy as well as closing any BPF or any bronchopleural fistula which is present. So they took him on the table. It was found out that he had air leaks from the apical lobe as well as from the right lower lobe. Latissimus dorsi graft was taken and placed, and they closed the leak. But post-procedure on the day 2, he had CO2 retention and intubation was done because of cardiorespiratory arrest. With positive pressure airway ventilation, both the leaks which were closed opened, and ICD tube has to be kept. He was referred to us with ICD tube in situ. On examination, he had persistent air leak. On CT scan, careful examination showed there is a leak from right medial basal segment and apical segment of right upper lobe. So, on check bronchoscopy, when balloon was inflated, we could see that BPF was closed when balloon was inflated at right lobe medial basal segment.
బబ్లింగ్ ఇప్పుడు వస్తుంది సార్.
బయటకు వచ్చారు సార్, బయటకు వచ్చారు.
On further subsegment evaluation, he had persistent leak from both the subsegments. Hence, a spigot was placed in the right lower lobe medial basal segment. Since there was no leak after that, apical segment was left alone. On the next day, when ICD tube was clamped, a pneumothorax was collected at the apical segment or in the upper lobe. Now, we have decided to place the spigot in the right upper lobe apical segment basing on the radiological picture. So, with great difficulty, we placed it in the apical lobe. And after that, on the immediate next day, we could see that even after clamping, no pneumothorax was collected. ICD tube was removed the next day, and he was off BiPAP and as well as tracheostomy tube, and he went home happily.